Okie doke, it's Kevin here. Another letter correction from my group, OET Writing with Kevin. Disclaimer first, as always, blah blah blah, teaching fair use, so don't go complaining, because I'm not interested. So we've got the writing assessment criteria here. Okay, so for the B we need 2555, so this is what we need at a minimum. So we've got the notes. Let me go here. So referral, assessment and management to the surgeon. So, okay, she wants surgical removal varicose veins. Okay. First part of the notes, not so much. We don't really need anything there. She's allergic to penicillin, so okay, we might need that. Not working as a housewife. I think I don't think that housewives would actually say that they're not working. I think and especially with two kids. So not working housewife. I think that housewives would not agree with that one. Anyway, so Mrs Lisa Hilton, we've got the DOB, right? So you don't really need 60-year-old housewife. That's not going to have any impact on what the surgeon does. You've got the DOB, so we can count 61, 2021, you know. So we don't really need that. Therefore, she would require, you mean she does require, she requires. So we don't need that. So you could do a right to refer Mrs Hilton, whose features are consistent, blah, 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 and who requires assessment and surgical intervention. And we don't need that for her ongoing condition, because it's obvious. So you could cut that down a little bit. Okay, I put the date first. On the 16th, Mrs Hilton presented. We don't need this to me, obviously, because you're the one who's writing this initially. So just put the date first. You know, on the 16th, Mrs Hilton presented, complaining of edema, severe leg pain. She had been observing since a pregnancy. But she's at 2. So which one? Which pregnancy is that talking about? After pregnancy. So this must be the last one then, I suppose. 2018. That. Let's have a look. So she's got 2 kids, 15 and 5. And is this supposed to be now? So 3. Okay, it's not very clear to me, but after pregnancy. So presumably this happened over both pregnancies. So occasionally, okay. Limiting pain bilateral low edema quickly after walking, while walking, multiple verses. Okay, right. So she had been observing since her pregnancy. I would maybe reword that to clear that up a bit, because right, what you need to basically do, right, is to think, if I were the reader of this, is everything clear? Because the reader wouldn't have access to the notes in reality. They just have this letter. Alright. So, that being said, I'm reading this. So, I've got, obviously, the advantage of the notes, but if you think about it, you shouldn't have to refer to the notes. Everything should be clear in your letter. So, I'm reading this now. Mrs Hilton, 60, housewife. She's 60, so she had so she had a last kid at 55. It said she's got one son who is 15. I mean, it's not impossible. She would have had him at 45. And another kid at 5, so she had him at 55? Eh? Really? Are you sure? That seems a little bit off. Let me just have a look at this, right? Well, it must be right then, but... So she is 60, she's got a 15-year-old kid. She had the first one at 45 and a second one at 55. Okay, if you say so. Anyway, so simply putting this here for the reader, it doesn't make a lot of sense. I mean, I'm not a bit confused here because 45 and 55. 45 maybe, but 55? Oh dear. Well, anyway, that aside. So present it to me. So put the date first. On the 16th, Mrs Hilton presented with blah blah blah. Is that a first pregnancy, a second pregnancy? That's, I'm not really clear about that. On physical examination, extension notices coffee and pulse were positive. Support documents and plans for surgery for discussed. On subsequent visit after 4 days. Well, to make it more concise, why don't you put the date? On was it the 16th? So after 4 days, on the 20th, Mrs Hilton returned, exhibiting anxiety due to non-effective analgesics, exaggerated pain, or something similar, right? So you could cut that down. So I would put the date. Mrs Hilton returned in a state of anxiety due to exaggerated pain for which analgesics were ineffective, or something. That's a bit better in terms of language, like clinical and factual, So I would probably do it like that. She was very anxious, were of no use. That's not very clinical language. Were ineffective, or her pain was non-responsive to analgesics. So I would maybe change that. Although her leg was all right, that's not clinical either, really, is it? Upon examination, so let's just go back again. I shouldn't have to do this. Right, it's stable. Right, so complaints, severe pain in right leg for days. So analgesics ineffective, or the pain was non-responsive to analgesics. That's more clinical language. Distressed, okay. Stable, right. So that's probably better than saying, although her leg was all right, so it was stable. So language. So that's not bad, right? She had been observing what we'll discuss, blah blah. Okay, so very anxious. Okay, analgesics were of no use. So I would maybe, as I say, make that something like, the analgesics were ineffective, or her pain was non-responsive to analgesics, not because they were of no use. That's not very clinical. On examination, although her leg was all right, that's not very good either. So something, stable. Her left leg, I think it's a left leg. Was it? Left leg, yeah. So you would have to kind of mention that, which kind of leg. Her left leg was stable. That's like 4 words. Well, left leg was stable. So that's 4 words from the case notes, and they don't like it if you copy them. But that's only 4. That's only 4 words, and that's better than although her leg was all right, which is not very clinical. So her might feel different to blood pressure was seen or noted. Consequently, were prescribed. Today, Mrs Hilton is stabilized, or is stable. So, right, present perfect has stabilized. If it's today, why not use present? It's simple. It's stable. Or Mrs Hilton's condition is stable. Or Mrs Hilton's condition has stabilized. Instead of saying Mrs Hilton, stabilized, because she hasn't really, she's not really performed any action. She's not stabilized herself. Her condition has stabilized, or she is stable. You could maybe do it like that. And where's the second picture? Where's the second one? Okay. Has agreed for the surgery. She's agreed to the surgery. She's agreed to the surgery, or to surgery. Please note, allergic to penicillin, and previously, shall they start? Well, you don't say previously, because if it's 5 years ago, 5 years back, before or prior, not back. Please note, she's allergic to penicillin and had a hysterectomy 5 years ago, or 5 years previously, not 5 years back. If you could assess her for surgery. Thank you for extending. You'd have to say thank you for extending your assistance. Well, he hasn't extended anything yet. He hasn't seen it yet. You're referring her to him, or the surgeon. So he's not extended anything yet. So you don't really need that. Just in view of the above, it would be appreciated, or I would appreciate. I would appreciate if you could assess her for surgery, etc. We don't really need that. Further queries, inquiries, don't hesitate to contact me. So that's good. Some of the language I say needs to be changed. 5 years back, 5 years previously is better. We don't need that. Thank you for extending your assistance, and he isn't. He's not extending. That would mean he would be contacting you first. So he isn't. You're contacting him first. So we don't need that. And I say, watch that language in, analgesics were of no use. Okay, you mean they were ineffective, or her pain was non-responsive to. Her leg was all right. Her left leg was stable. So change that. Maybe change to stabilized. Her condition has stabilized, or she is stable. And now we know what this means because we've seen the notes, even though I don't know where you got those from, but there must be something wrong. So she is 16 and she's got a 5-year-old son. Really? But that's not very clear, because there's no mention of kids. You haven't, there's no mention. So the surgeon is reading this. Sorry. Okay, 6 years a housewife, since pregnancy. So without this information, because the surgeon is thinking, well, she is 60 now since a pregnancy. So what was that? 30 years ago, 40 years ago? When exactly? So that's not very clear to the reader. Obviously, we know because we've seen the kind of notes. Even I think there must be some mistake in those, but though still. So that's what I would do for that one, right? That's not too bad. Just watch some of the phrasing, get the clinical language. Okay. Where are we? Referral letters. Right. A clinical, factual way, not including judgments, kind of feelings. All right. Target reader, professional, register, and tone. So try and reword that. But that aside, content, it's like something is kind of missing there, because it's like, pregnancy, what pregnancy, how, who, where, what, why, when, so it's, the best way, as I say, to think about this is if you put yourself in the shoes of a reader, right? And think, right, if I only had this information, this kind of letter, does it make sense? Is everything clear? And it's obvious, whether it's due to the notes or to that to the reader, the pregnancy thing, it just pops up out of nowhere. There's no lead in. We don't know when it was. So it's like, what does that mean? So if you've got to ask any questions, so when you're reviewing your writing, if there's any questions, if you find yourself asking, what does this mean? What does that mean? Who, how, where, what? Then it's obviously not as effective as it could be. Okay? So that's something to have a think about. So the content's got to be clear, logical. Okay? Language is good, but watch that genre and style. I think that could certainly be improved. So that isn't bad. There's one or two little things that I would certainly have a look at. Okay, right. I hope that helps.